I would like to welcome everyone who uh, who is going to watch that video. Again, today it's August. It's Tuesday. It's August 23rd, 2022, and as mentioned on the board, my name is Yannick Dantiste. I am a family nurse practitioner, and currently I'm working in West Palm Beach, Florida, in health field. I've been in health field for since 1985, I believe. Yeah. So So the topic for today for this video will be, uh, as mentioned here, what is the reality assessment. So in other words, it's what is the health risk assessment? That's meaning the same thing. Um, the reason I would like to touch that subject because we need to know where we at. We need to know our baseline before we, um, if we want to improve our health, we need to start somewhere. So, okay, and that somewhere is we really need to do a thorough health assessment to find out where we are right now. Okay, how we can improve it, and or which where exactly we can improve it. So as usual, before we start, I would like to start with a word of motivation, motivational words or inspirational words is the same thing. So the motivational words for this video today start like this: Life is short, time is fast, no replay, no rewind. So enjoy every moment as it counts, or as it comes. Okay, so I'm going to repeat it again. So for today video, motivational words or inspirational words is: life is short, time is fast, no replay, no rewind. So enjoy every moment as it comes. So it's really, because we just start 2022 and we already in August. So before we know, we're going to be in 2024. I mean 23. Really the time, time is very fast. Time is going very fast, and life is very short. So enjoy it because no one can rewind your time. No one can replay it. Whatever time we lost it forever. So that's why we have to make the best we can, to stay healthy so we can enjoy our life, because we can have everything in this world. We can have all the money, in this world, all the big houses and everything. But if you don't have your health, if you don't have the optimal health, it would be very difficult to enjoy all the material things. So for that reason, we are going to work together, okay, to explore, about the health, about health promotion, disease prevention, what we can do to make our health better. Again, nobody has a perfect health. There's no such thing. Okay, everybody, we are trying, but some people, they just talk. They don't really do the work. So what we need to do, we really need to find out, what we can do to make our health better. If we know something is not good, like smoking, like drinking alcohol, taking drugs, we know that those things, they're not good, they are not healthy for us. So we should really, you know, try to stay away from those bad habits, because at the end that will affect our health one way or the other. Okay, even though we uh, believe it or not, that will happen. So like we, you know, we, like we has discussed before about um uh, you know, we had in introduction introduction about health factors. So we talk, you know, we talk about why do you want to be healthy. We discuss about that. The reason, what are the reason to stay healthy. And you know, in health we have bad news. So we had discussed about the bad news about health and the good news. So this video now, we are going to discuss what is the health reality assessment. Um, as we know, okay, the health reality assessment, what is it? The health reality assessment is intended to help people get in touch with their true risk of potential illness in time to take preventive measures. So I'm going to repeat it again. What is the health reality assessment? It's the same thing, you know, your health risk assessment. So it's similar. So the health reality assessment is intended. What the what the this assessment mean? What this assessment want to convey? So it's intended to help people get in touch with their true risk. Okay, the real risk of potential illness in time to take preventive measure. So he, with that health reality assessment, it will help us to discover what are our risk, okay, and what measure we can take to prevent those diseases. So very few people thinks that they will experience serious health problem later in life. So they think that, you know, if somebody else will get sick, but not them. Okay, so they are invincible. You know, they are doing everything. You know, they think is good, and they are not going to get sick until uh, they hit with the bad news. You know, so they have the wake up calls, and that's when they realize that, you know, them too, they can be affected by an illness, by a disease. So when people are diagnosed with cancer, heart disease, diabetes, or high blood pressure, so those people, they have expressed that they were shocked at their diagnosis, because they thought that this disease only happened to other people, not them. Okay, so, you know, most often that's what happened when someone, you know, they get hit with that diagnosis, that they realize that, you know, they have cancer, you know, they have heart disease, uh, diabetic, so they got shocked. You know, they cannot believe that's happened to them, because they thought that that will happen to, you know, their neighbors, you know, their friends, but not to them. Um, so so that's when sometime, you know, they they realize, and they're thinking, you know, what went wrong. and and once you are affected, so now this is in another um what it is, you know, phase in your life. So now you we now we have to to deal with now we have to deal with it now, by looking for a provider, to see us, to assess it, and to do some tests. I mean, it's lengthy. Um, so there's some health factors, okay? So we call it health factoids, but it's some health factors. So what are those health factors? Um, can you raise that? So now we are going to discuss about. Let's get some statistic. Okay, some statistic. So health factors or factoids is the same thing. Okay, so let's get some facts, right? So what is some we have some health datas. So 50 years ago, okay, according to research, 50 years ago, only 10% of the population was chronically ill. So that's meaning 50 years ago, um, so only 10% of the population were hit with chronic disease. Okay, so now that the number now is 60%. So it's very, that increased exponentially. Okay, so 50 years ago it was 10%, and now in 2018, this is when the research was conducted. Now they find out it's 60%. So maybe now it's 70% in 2022. So that's meaning that, which means that the population is getting sicker and sicker. Also, 1 in 3. Okay, so the statistics said 1 in 3 people. Okay, 1 in 3 people, or 1 in 3 Americans, because this is where we are now. We are in the United States. So 1 in 3 American will die from some form of cancer. So if we take 3 people, okay, one of those people will die from one type of cancer. So this is the statistic. Also, more than 33% of men uh, will develop some form of cardiovascular disease by the age of 60. So 33%. That's uh, substantial. More than 50 million Americans suffer from arthritis and related conditions. So, like joint disease. So we have 50 millions of Americans, they're suffering from joint disease. So that's why when we go to the pharmacy, we find, all those, medication for inflammation, for arthritis. We found like Advil, ibuprofen, naproxen, gel for pain, because the population, they really, it's a lot, like 30, 50 millions. So that's a lot. Diabetics affect more than 15 million people, with many more cases they are undiagnosed. So diabetic alone Okay. Um, okay. So um, that diabetic alone, they have 16 million of people with diabetic. So type 2, most likely, most of the time. So we have 16 million of Americans who are diagnosed with diabetic, and also we have more they're undiagnosed. So this is, the chronic disease. We really have plenty of them. So the percentage of overweight adult in America has reached an all-time high of 70%. So 70% of Americans, they're overweight. Okay, so we have 70% um, of people, of American, they're overweight. 70%. So that's a lot. So once you have that condition, this is the condition which can lead to diabetic, heart disease, cancer. Um, Also, obesity and the resulting health consequences, which is diabetic, heart attack, heart disease, cost the cost the U.S. economy $117 billion in 2020. So it's very costly. Chronic disease is very costly for the United States. And it's not, it's worldwide. Over half of all women over 55 have some degrees of osteoporosis. So they said over half of all women over 55, they have brittle bones. Okay, osteoporosis. This is the bone disease. Also, healthcare costs as a percentage of the GNP, okay, the gross national, um, numbers have risen from, the GNP has risen from 7.5% in 1970 to 20% in 2005. So more than doubled. And also, as I said before, also statistics shows that 70% of all illness and disease is preventable. So we can prevent 70% of the diseases, okay, 70% of illness can be preventable if we change our lifestyle. Okay. So now we can talk about the health factors, the health factories or the health risk. So let's say what are the health risk uh, can con- can con- can contribute to unhealthy living or diseases or chronic disease, like heart disease, cancer, diabetes. So what are those health risks? So let's start with them. Okay, so we I'm going to put them on the board so we can remember, because as we know, some people, they are visual. When we see, when you write it, you see it, your brain catch it, and you can remember it. So the health factoid. Okay, So factors, okay, and also health risk. We can call it also what are the health risk to become sick, okay. So the first one, so those we have 10 of them, and those one, this is the one we can change. This is the one we can modify, such as the health risk factors such as age, race, sex. Those things we cannot change them. Okay, so some diseases, the men they are high risk, to have some diseases than the women. And in general, the more we're getting older, so this is the more we are getting sicker. So those things we cannot change it, but there's some health risk factors we can change. So this is what we are going to discover now. So what are they? Okay, the first one, um um so the health factor one is family history. We cannot change that, but if we know family history, that can help us to on the God, that can help us to understand what kind of disease this family has, or what they don't have. Okay, so uh family history is one. Okay, so what they said about family history is that, um so we have to know, how well, okay, uh how well have you assessed your uh family health history and taken measures to avoid hereditary diseases. Okay, so we can take some measure to avoid some hereditary diseases. And also the next one is weight control. Okay, this is another risk, health factors or health risk. Weight control. So in the weight control is that, okay, we have to ask, ourselves, how well have you assessed your weight and taken measure to ensure your weight is not a problem to your health. So we need to remain at an optimal weight. So according to your height, you need to remain at certain weight. So you cannot be over that recommended weight, because if more you have weight above the recommended weight, so this is a risk for you to become sick. Okay, so the weight control is one, and the next one is tobacco. So the smoking thing, tobacco control. Okay, that risk factor we really can, uh, eliminate that by not smoking. That's easy. Okay, I mean, it's not easy to stop, but that's something people can do. Also, see, it's you have to ask yourself, how well have you been able to avoid tobacco of any kind in order to minimize its negative influence on your health. Okay, and also it's not only the primary tobacco, also the second ends also. I met people that who has cancer, like lung cancer, because tobacco, it's lung cancer, it's related to smoking. So I met some patient, they said, well, I don't know why I have lung cancer or bladder cancer because I never smoke. But my next question to them is that, do you ever have somebody, in your household who had smoke? And sometimes, yeah, they do. Sometimes it's their husband, or sometimes um, it's someone, in their home who used to smoke. So the second hands, um, is, it's as bad or sometimes worst. And also depending where also people they hang out with, like if you uh hang out where a lot of people smoke, the second smoke, this is very um uh damaging to your health. So we have to keep, that in mind. And the next one is exercise control. um, the next one is exercise control. So this is the next risk factor or health factor, okay, who is very important. So we have to control that. So so how well have you, so you have to ask the questions, how well have you been able sustain a regular aerobic and weight tr- uh, training routine to ensure a high level of illness. Like I said before, walking is good, swimming is good, brisk walking, so all those exercise help. And the next one, so we have family history, the weight control, tobacco control, exercise. This is all health factors or risk factors which can contribute for someone to be sick or to get sick. So the next one, let me erase that because we have more. So the next one is healthy diet. Healthy diet is another health factors who really, is important for you to keep, to be healthy, your diet. So you have to ask yourself, how well do you maintain a healthy diet, which is low in fat and sugar, but high in vegetables, fruits, water, non-animals proteins such as, grains, not eggs, grains, um, tofu, and whole grain fibers. So, this is question we have to ask ourselves. Okay, how well we eat. If we have a balanced diet, etc., etc. So this is the question we have to ask yourself when we are doing health risk assessment, okay, or health reality assessment. This is the same thing. And also the next one is beside the healthy diet, uh, beside the healthy diet, the next one is stress control. So stress control is very important, okay, to do if you want to stay healthy. As we know, stress can give everything. Stress can cause everything from depression to um, heart disease to cancer. It's is really a big things. People need to manage their stress. They need to reduce your stress level as much as you can. You can, you have to ask yourself, how well have you been able to identify it? Because sometimes also people, they cannot identify if they are in a stressful situation. Okay, it's like stressful situation can be in anything, like, you change your job, you get fired from your job, you get divorced, even though it's a good divorce, even though people think, this is a good divorce, you're going to be happy, but it's all those things come with the divorce, all those paperwork, you have to go to the lawyer, all those setback, is, that can be stressful also. um Bankruptcy, foreclosure, all those bad stress can affect someone health. So we have to keep in mind, try to reduce your stress as much as you can, because stress will affect uh, your health. Okay, the next one, beside this, after stress, is health exam. Okay, this is health exam. This is another health factors or health risk factors. So a health exam. So you can ask yourself, um, how well do you assess your actual state of health through regular exam for breast cancer, for prostate cancer, for a disease, for diabetic, cholesterol, hypertension, etc. So you ask yourself, how well do you assess your actual state of health by doing all those things? Did you go to, do you see the doctor or your provider? Do you do regular exam, to to um, to assess for breast cancer, to assess for prostate cancer. Prostate cancer is lab work. We have a lab work called PSA. They just they can just draw the lab with all the labs, and most of the time, if a man has prostate cancer, they can discover that by lab work most of the time, or a heart disease, diabetic, cholesterol. So the health exam, it's important. This is one of the health um, factors or health risk factors. And the next one is home and personal. Let's see. The next health factors is home and personal um, factors. So you have to ask yourself, how well do you maintain a stable home and personal life? Okay, how, this is question you can ask yourself. How well do you maintain a stable home and personal life, which provides positive support for your health? So if your home is not a stable home, you know there's always fight in your home, um you know so that can affect your health. Okay, so it's important. um the next one is work life. So your workplace can be a very stressful situation for you, and that can affect your health. So you have to ask yourself, how well do you maintain a stable and positive work environment or work life, which is rewarding and supportive of good health. Okay, so ask yourself, your workplace. Okay, how well do you maintain a stable and positive work life or environment, which is rewarding and supportive or good health. Um, just recently, I personally, I was working to department. So I changed. I went there for just to helping, and it was so stressful, so stressful. I didn't like it at all, and I was miserable. I was unhappy. Thanks God, my supervisor is excellent. I thank him, and I had, and I finally I went back to where I used to work, and now I'm much happier. And now I'm happy when I go to work. So you have to have that kind of feeling, because if you go to work, you have to go to work every day, and if you don't feel happy, this is a stress. That stress level will be so high every day. That will affect your blood pressure, that will affect your mood, your pulse, and everything. You don't need that. As much as you can, if you can change your work situation, if you have a good supervisor like me, so this is the best. So I'm so thankful for my supervisor, who is Dr. Mandy. So he is excellent. So he's so supportive. So I was able to change. So now I feel much better. So this is thing you can, whatever you can change, you change it. Something you cannot change, I get that, I understand it. Like your age, your sex, your race, you cannot change it. But if something you can change to improve your health, by all means, please do it. Again, you have to remember, you only have one health. So, and the next, after your work life, is health knowledge. So this is my mission. Okay, my mission is to give, is to help as much as I can, to give the health knowledge, so people can have the knowledge to make decision, to make informed consent, to make informed choices. Because if you don't have the health knowledge, people won't be able to make uh, some good choices. Because um, we have so many noises, so many people, they are talking about everything and anything, and sometimes they don't even know what they are talking. So it's good, you go to the good sources, read book, go to scientific based research to get your information regarding health. So the last one but not least, okay, so is health knowledge. So this is another health factors or health risk factors also, which can help people to stay healthy, or to um, deplete your health. So health knowledge. Okay, so the health knowledge, you can um, the health knowledge, you can ask yourself, how well do I maintain my knowledge about health and wellness through regular reading and development of a personal health improvement strategy. So how well do I inform myself about health? And again, it's very important. Um, it's very important to acknowledge where you get your information. Do not get it from everywhere. Okay, especially word of mouth. Okay, some people, they're just talking from the top of their head. They don't even read. They don't even like to read, but they know everything. They will give you bad information. So you want to make sure that the information is it's scientific based. It's this is the right one. It's very important to make sure of that. So all those health factor I just mentioned, like family history, the weight control. You ask yourself, is it my, do I have uh family history that can affect my health? Okay, it's like me personally. I have a uh brother who died at 45, 46 years old of brain cancer. So by knowing that, there's thing I can do to help me, like stay away from smoking, stay away from drinking, um, doing drugs, because you don't know all those things. So you try to mitigate that by having a healthy living. So, to try to decrease your risk, as much as possible. It's not 100% sure, but at least you try something. Okay, so you are, the family history, the weight control. The weight control, um, so you need to know your ideal weight. Okay, you're usually a female. They said a female, um, for the weight. Okay, so for the weight, usually the American Heart Association, what they said for female, if their height is 5 feet. Okay, let's say a female is 5 feet, so they said they should weigh 100 pounds. So in order for they mitigate their risk factor, to getting sick. And sorry, and for each inch, okay, it's 5 pounds. And for this is for female. So for male, it's 5 feet. It's 106 pounds. And for um for each inch, it's 6 pounds. Okay, so that's how you calculate it. So you can talk to your provider and ask him, and ask him or her, what is my ideal weight according to, because they do have a chart, they follow. So ask them what is my ideal weight and try to remain close by. One, 5 to 10 pounds extra is not a big deal, but it's when you're starting to go over 15, 20 pounds. That's when the risk factor for your health, it's getting worse. So this is the, for female, if you measure 5 feet, you should be 100 pounds. And after that, for each inch is 5 pounds. You add. That's what it is for male. For men, for if that man measure 5 feet, is 106 pounds, and for each inch is 6 pounds. So you add up. So this is how you do it, or you ask your provider, and your provider will let you know exactly uh, how much weight, how much weight you should have. So that's how we are doing it. Okay. So it's important, so the main, the 10th health factors, the risk factors, people can you can control it, it's, the weight control, tobacco control. You try not to smoke. If you smoke, try to stop, at least cut down your smoking. But if you stop, this is the best. Exercise program is important. Healthy diet, healthy diet. Um, the diet is is extremely important. To try to eat a balanced and a healthy diet. Stress, as we know, to control your stress is important. Health exams, go see your provider. Do your health exam every year. Do your lab work, because some condition, some diseases, we can discover that, by doing your lab work. Let's say somebody has a beginning of leukemia. So your CBC, we can see that, in CBC. We can have an idea, and then they they will be refer that person to a specialist for the test. So some lab work, it's, can help, um, can help to discover some disease, diseases. So, it's important um, to see your provider regularly and follow with your lab work. And after you do your lab work, make sure, your blood work, make sure you go back, or you call your provider and ask for the results. So you need to follow up and do your your mammograms for prevention. This is a primary prevention for breast cancer. I know but some women like it, some women don't. But self breast exam, is important. For male testicular exam every month is important. So there's thing we can do, and um, it's not big, but at least that will help. Also, home and personal, your home, try to keep your home clean, you know at peace. That will help your work life too, your work environment. Try to live like a family at work, because most of the time we spend more time at work than at home. So your workplace should be really a welcome place. When you be there, you feel like home. You feel, you really feel that this is a place I want to be. So this is important. And also, lastly, the health knowledge. More knowledge you have, is more uh, right decision you can make. About what to do, how to follow, which doctor to see, which provider to see. So, like for instance, if you have um, a symptom in your uh, reproductive system, you have to see a gynecologist. If you are female, if you are a man, a urologist. So those knowledge help a lot. So hopefully that help. That those that thing has helped to really to discover, to distinguish, like, different health risk assessment, different factors, okay, that can contribute, that can cause someone to be sick. Okay, so once you discover those, and you act on on them. So hopefully that will help you to have a better health. So this is the aim, this is the vision. Everybody would like to remain to have a optimal health. So by having optimal health, there is thing we have to do. First of all, um, we have to discover. We have to discover. Okay, what is my risk? How can I mitigate those risks in order for me to stay healthy or to improve my health. So that's why this is the two things, to stay healthy or to improve it. Okay. So again, do not forget, about always remember about health promotion, disease prevention. This is the key. Health promotion, disease prevention. Because once we get sick, now we start another phase now. Now it's to go find the right provider. Now it's treatment. So it's good, to really focus on health promotion, disease prevention. So this is the key. So how we do that, always try to eat a balanced meal, get plenty rest, sleep, get some sleep, reduce your stress level, drink, when you're thirsty, try to drink water. If you can drink alkaline water, this is the best one. And exercise, whatever you can do for exercise. You can swim, you swim. If you can walk, you walk. Whatever you can do, whatever the little thing that will add and that will really help you to maintain your health, your optimal health. This is what trying to we are trying to accomplish that. So we will make sure that, just to make sure that whatever little thing you do, you don't need to do drastic change. Just do little by little, and and you will be fine. Okay. um so when I said to drink plenty, drink water, there's some exception, like people who has a chronic kidney disease, or people who has CHF for congestive heart failure. Those people, they cannot drink too much water. They need to limit their water intake, because more water they drink, um, they um, more water they drink, that's when their breathing will be, heavier. They won't be able to breathe better, or they can, those water will be accumulated in, into their body. So we do have some exceptions. So those people those in the individual, they know because their provider told them. But beside them, beside those people who have CHF for congestive heart failure, or chronic kidney disease, people on dialysis, so those people, they cannot drink, liberalize, like as they please. They cannot drink water as they please. So they have to limit their water intake. But we got, beside them, it's good you drink, your water, you exercise, you rest as much as you can, and then, try to um uh, try to get your, information read. And this way you can, when this way you can decide what to do if something happen. If you discover that you have a disease, you have an illness, so you can know where to go, who to call, and and you can help. Beside yourself, you can help your friend, you can help your loved one. So on that, I'm going to end there, and and I wish you guys the best of health, and until next time. Bye bye.